So you want to go through that. It also talks about type 2 diabetes, what metabolic syndrome X is. Basically the difference between metabolic syndrome and type 2 diabetes is if your blood glucose rate is 100 to 125, it's metabolic syndrome X, which is pre-diabetes. If it's above 125, you're diabetic, type 2 diabetic. So it talks about glycemic index. And what we're going to do, because we're running out of time, is I'm going to have to go through this and do like a webinar thing where I'll record it and put it online. More glossary stuff, gynecomastia, we talked about that. Anabolic, catabolic, BPH, you'll hear Gary talk about BPH. PSA, prostate-specific antigen. We always check PSA levels. Anybody over 45, if we don't have a PSA level from them, we will not pellet them. Okay, we don't negotiate on that. That may change because there are studies out there now that show that, you know, it used to be thought that, again, like I said, high testosterone caused prostate cancer. It does not. Testosterone actually prevents prostate cancer. It's high estrogen, bad estrogen, and low testosterone that causes prostate cancer. But there's still people out there that think that if I give a guy with prostate cancer testosterone replacement therapy, it's like throwing gas on an open fire. And it's just not true. But the conventional thinking of medicine is still that. So even though we know it's not true, we're not out there pushing it yet, that you can go ahead and give them testosterone therapy. One of my doctors, we're going to be friends forever because I talked her brother into getting pelleted. And her brother had kind of the same thing that happened with Angela and I. Very newly married, his wife got breast cancer, went through all the same stuff. He was depressed all the time. He wasn't sleeping and all this stuff. And she's like, his story mimics yours very closely. Would you mind talking to him? I'm like, no, I'd be happy to talk to him. So Angela and I went over to their house, had dinner with her brother and all this, got pelleted, and she said he did this 180. He just completely turned around. And he was so excited, and her mom came up and gave me a hug. We were doing a health fair at her practice, and she came up. I didn't even know who this old lady was. She came up and gave me a big hug, and, oh, you're the BioT guy, and you saved my son's life and all this stuff. Well, not too long ago, she calls me and she says, hey, he was diagnosed with prostate cancer. So he's more upset that he's got to come off his pellets than that he has prostate cancer. Because the pellets had completely changed his life. I mean, he literally did a 180. He wasn't depressed anymore. Libido came back, saved their marriage, all this stuff. So I told her, I said, well, actually, there's a lot of studies out there that show that it can help your brother. So she went and talked to his urologist, went and looked up all these studies. Long story short, he is still pelleted, and he has prostate, and he's now gone through the surgery, and everything's great. So, you know, and he didn't have to give up his pellets. So, you know, anyway, yes, sir.
Does the PSA go up when you go on pellets?
It can elevate, but it won't elevate by more than 1/10 of a point. So if you're at, let's say, 2.1, it could maybe go to 2.2. But if you go to 3.2, it's not the pellet. Pellets don't make it elevate that much. It can elevate like 1/10 of a point, and that's it. Most of the time it doesn't elevate at all. But if it's already somewhat enlarged, it can make it go up a little bit. But if you jump more than a point, it's definitely not the pellet, and you want to have them, send them for a workup. Any other questions on that? Okay. So we talk about compounding, pharmacopoeia, off-label use, free radicals, antioxidants, nursing levels. Nursing levels is good to know because it allows you to know who can do what in different states. One of the easiest ways to know, well, if you need to know in your state who can do what, ask us, we usually know. But to know if a nurse, for example, can do the procedure in your state, usually the easiest way to know is if they can do an injection in your state, they can usually do our procedure legally, okay? Doesn't mean that they can dose it and all that, but they can actually do the procedure. Like earlier we were talking about, you know, an RN can do the procedure, but they can't do the diagnosis, they can't prescribe, they can't do all that. If the doctor's already met with them, done the consult, decided the dose, they can give that to the nurse can actually do the procedure, okay? But they can't do it beginning to end. Does that make sense? Okay, so it's good to know those levels. Some conventional medical facts. Xenoestrogens, we get into that. Clinical pearls, I'm not going to go through these today because you guys are going to sit through didactic, and Gary goes through these. Same thing with troubleshooting. My pellets didn't work last time. This is all pretty much just, for our doctor's use, but you guys should know it. So when you have doctors ask you questions like the person says, I don't feel like my girlfriend did, or I don't feel as good the second time as I did the first time, all that stuff, you've got to be able to explain that away. And it's not explain it away, that's not a good way to say that. You've got to be able to educate them on why it is that way. So we've also got a big section in here on DIM, so make sure you read that. The last couple of pages here, setting up a practice. This is just pictures at Gary's of kind of how he's organized all his stuff for his supplies when he goes to pellet people. So you've got your betadine, you've got your steri strips, all that stuff. This page here, we also go over in the MA training, which you guys will get a copy of. This is the, a lot of people, if they don't already have an autoclave, which occasionally you'll go into a practice that does not have an autoclave. Does everybody know what an autoclave is? That's what you use to sterilize the instruments. Our trocars are stainless steel. We've actually just, we're patenting our own trocar that we've had developed for ourselves, and we're going titanium on that, but they have to be autoclaved. They're not disposable. Okay, so like the doctor I'm talking to in Oklahoma City that's pelleting right now, they're buying trocarkit.com. You can go there. It's pretty funny if you go look at their website. Trocarkit.com, they sell a plastic trocar. And they've got little plastic tweezers in there and everything else. And they actually teach doctors how to dose on their website, which once you guys get into this and learn this, you go look at their dosing, you're going to go, wow, that is whacked, because it is bad. And I tell doctors all the time, you can go to trocarkit.com right now and you can learn how to dose. Go for it. If that's what you want to do, go for it. And you're going to over-estrogenize a lot of people. You're going to get called in court, and then what's going to happen is you're going to go say, oh, where'd you learn how to dose? Oh, plastics manufacturer that wanted to sell me trocars taught me how to dose. Right on their website, pictures and everything. Go for it, if that's what you want to do. You want to save a buck, go for it. So in the long run, it's not going to work out well for you. But they cost $25 a kit, just so you guys know.
On that website that had all the studies, I went to her website. It actually showed a presentation that had the plastic kits in it. Does she use that?
She's actually patented, she's the only one that can make a 4.5 millimeter plastic trocar. Trocarkit.com can only make a 3.5 millimeter trocar, which is what we use for our female pellets. 4.5 is what you need for a male pellet. So you have to go through her to buy a 4.5 if you want to get a plastic trocar.
Are they?
They're not as good.
Okay.
I mean, it's a way for them to make money, is all it is. And you don't have to worry about a autoclave. But like this lady in Oklahoma City I'm talking to, she's broke 2 trocars off in guys' butts already.
Well, you know that we called on Dr. Marshall up in Solana Beach on one time, and we talked to the nurse. That was one of her issues, is space for an autoclave and that sort of thing. I actually ordered one from trocarkit.com just because I used to sell instrumentation.
Right.
And I'm here to tell you, I agree with it. I mean, it had a sharp edge on it that gets caught in the fascia going in. It's going to make a mess. So it was nice to feel it, and I don't know if we have one here, but I don't know. It's just,
Gary bought from them at one time. It's funny because if you go to their website, it lists Gary. I'm like, Gary, you need to go tell them to take that off, because it lists him that he was a prior patient, or not a patient, but a prior doctor that had ordered, and he ordered them just to try them, because he's like, well, we're spending $300 and some a kit for autoclavable, one that's going to last, and it's way better. But they've tried them, and he snapped one off in the guy's rear, because you get these guys that do shots and they got all that scar tissue built up. Micah, who you guys know, and I mean, he doesn't care. I mean, he'll be the first one to tell you, his ass looks like cottage cheese because he's done so many shots. And when I saw him get pelleted by Jolene, she bent the needle over twice trying to just numb his butt. And the needle was not very big. I mean, but literally, it was so hard to go in. And I thought I was going to have to get behind her and give her leverage to get the trocar in. Yeah, I mean, it's sad because I told him, I said, you may not be able to get pellets very long because you've got so much scar tissue built up. We're going to run out of places to put pellets.
You have to go to the hip, you can't go to the...
You can do abdomen, but it's very painful. Gary actually pelleted himself in the abdomen one time, and that's the way they used to do it all the time. You'll find out, we're guinea pigs. You guys don't have to be, but we are. I mean, when we go to try something new, we're going to do it on ourselves before. All doctors are that way. You'll find out when you sign up a doctor that they're like that. And I'll get back to that in a second, but the abdomen's not good. But you can, I mean, last case, you know, last ditch effort, you could go there, but it's painful. Because I mean, your belt hits there, and every time you sit, your abdomen bends, stuff like that. So where it goes in the hip, I mean, you very rarely ever hit it. So, but the thing back to doctors use themselves as guinea pigs. When I first signed up Deanne Strobel, who's an OB-GYN, she's married to her husband Winston is a hotshot cardiologist. And she came through training and she's like, oh my God, this is so great. Winston's just gonna love this because it's so great for your heart. You might want to temper that enthusiasm a little bit. I said, you know, most doctors, if they're not up on it, they're down on it. Oh no, you don't know Winston, he's not like that at all. And I said, well, let me give you some cardiac studies just in case. And I said, because a lot of times what we've seen is when you go to somebody like that, they'll go, you know, are you going to tell me as an OB-GYN you know more about the heart than I do, a cardiologist? And she's like, I swear he's nothing like that. Well, they got in a fight because that's exactly what he did. He said, really? Really, Deanne? You're going to tell me you know more about the heart than I do? Really? I mean, he used the really, really a couple times on her. And she's like, well, here's really for you. You're really getting pelleted whether you want to or not. Really. So, and she's telling me this, I'm laughing, I'm cracking up, and she's like, I can't believe he did that. Well, he watched his own lipid panel. He now sends her 3 to 4 patients a day. She's pelleting 180 people a month, this OB-GYN is, and because he's so big on it. He's like, you know, he watched his own lipid panel and everything it did for him, and he's just sending her patients right and left. So it's pretty cool, but that's a doctor using themselves as a guinea pig. And she was pulling her blood every 2 weeks, checking her levels, because, you know, I told her you don't really wean off and all that. But they always, you'll have your own doctors tell you that. I had one of my doctors in Oklahoma City, every time I'd go in his office, he'd show me his blood work. He'd pull his blood work every week, once a week, pull his blood work, and he'd have them all, and he's like, oh my God, this is so cool. And they were so big into bioidenticals, they built their own compounding pharmacy. But they never got into pellets because they were scared to death to dose them. So anyway, that's also the same doctor that left and now is buying pellets on their own and having all kinds of problems. So, and the only reason they left, by the way, because I know I've said that a couple times, we had a contract when I had first signed them. They were my second doctor to ever sign. Our contracts over a year and a half ago had a clause in there that if we ever changed our name, they could get out of the contract, no problem. And they used it. So anyway, and then the guy had the audacity to tell me it's not personal. Like, you just took 30 grand a year out of my pocket and it's not personal? I'm pretty sure that's personal. So anyway, and now they want to come back because they're having all these issues. And I'm like, you're kind of giving yourself a bad name now. So.